Dr. G, how do you determine the length of a scar? Sometimes I've seen in before and after pictures, it almost looks like a great big smile where the scars from their tummy tuck are coming out of their underwear on the sides. How do you determine that length and if they have to have that?
Well, that's an excellent question too, and I will say that there's sort of an unwritten, or actually I guess it is written, but it's sort of an unofficial principle with plastic surgery, and it applies not just to tummy tucks, but even when we're removing moles or doing scar revisions, it's sort of a length-width ratio. When you're removing a certain width, there's a certain length that goes with that, and most surgeons will think of that as being in the neighborhood of 3-to-1 or 4-to-1. So in other words, as long as or as wide as what you're removing is this way, it has to be 3 to 4 times as long this way in order for those skin edges to lay down nice and flat. So on a tummy tuck, if you think about going from that pubic bone area that we talked about earlier with placement, how far up we have to go to remove all of the excess skin, that'll give you an idea of how far out width-wise you're going to have to go in order to get everything to lay down smoothly. And you know, all of the surgeons are nice guys. We want to try to be nice to our patients and give them as short a scar as possible, but we're doing them no favors if we make the scar too short. And you can tell when a surgeon has tried to be too nice of a guy and made the scar a little too short because you get this little thing called a dog ear, which a lot of the viewers might be familiar with, and that's just a little buckle of the skin and fatty tissue at the end of an incision where the surgeon just really needed to make that incision just a little bit longer to get that to lay down flat.